My name's Denise Musselman. I am the Apprise Coordinator for Lehigh County. And what the Apprise Program does is we are a state health insurance program. And I have trained counselors throughout the county at different locations where they'll sit one-on-one with individuals and go over your health choice options if you're on Medicare. Now, of course, because of the pandemic, we hadn't had in-person counseling in quite a while. We've been doing everything over the telephone or by email. We are starting to open a little bit more now with the in-person training, and I have left that up to my individual counselors as to whether they're comfortable or not, because of the fact that we are still having some problems. Okay, what we're going to cover today is the overview of the Apprise program. I just talked about that a little bit. Medicare Basics, the parts of Medicare, the options, your costs, enrollment. The costs are going to be hard to talk about, except, like how much your Medicare Part B premium is or your Medicare Part A, but as far as actual, how much you would pay for your supplemental insurances and stuff, that varies. So that I really can't go into. That would depend on your cost comparisons. Then we do a coordination of benefits, the penalties, switching plans, cost saving programs, and where to find help. Okay, what is Apprise? As I said, it's a state health insurance program, and we provide health insurance services to people who are on Medicare, and it's through the area of aging offices, throughout the state, and there's 52 of those. We have nearly 600 volunteers statewide, and we currently serve 250,000 people in Pennsylvania. Okay. Now, how does Apprise assist Medicare beneficiaries? As I said, we can provide free, unbiased, personalized counseling. That means we can do cost comparisons for people and have them see which would be the best secondary insurance for them. I'll get into the different types of secondary insurance in a few minutes. We can assist people with filing appeals. For an example, if somebody gets their Medicare statement and Medicare didn't pay for something and the beneficiary feels that it should have been paid for, they have a legal right to file an appeal, and we can help them file that appeal. Of course, we assist with plan enrollments, especially during the annual open enrollment. We can help enroll people into public programs such as PACE or the Medicare Savings Program or the Low Income Subsidy Program, and I will talk about those in a few minutes also. And we can interpret Medicare rules, and we can address coordination of benefits. Okay, as I said before, our services have been delivered by email and telephone because of the pandemic. We are starting to open up a little bit more to in-person counseling, but that's going to vary from counseling site to counseling site. Okay, the Medicare Basics is what is Medicare, how to enroll, what are the parts of Medicare, how much does Medicare cost, and what are the coverage options. The red, white, and blue card here is what your Medicare card will look like. There will always be a date for the Part A and the Part B. That's when the coverage begins. Not everybody has their Part A and Part B begin the exact same time. For an example, if you turn 65 and you continue to work, you would not want to get Medicare Part B because you have to pay for that. You would still be on your employer insurance, so you would just take the Medicare Part A because you've earned that by working. Then when you're getting ready to retire, about 3 months prior to your retirement, you would apply for Medicare Part B. And that means then that your start dates for the A and B would be different. Okay, Medicare is a federal health insurance program. It's for people 65 and older. People under 65 can get Medicare if they have end-stage renal disease, Lou Gehrig's disease, or other disabilities determined by the Social Security Administration. You must be a US citizen or legal immigrant for at least 5 years. And for people under 65, in order to get Medicare, they must be on disability for 24 months. The 25th month they are on disability, then they are eligible for Medicare. And no, Medicare is not the same as Medicaid. Okay, Medicare has 4 parts. Medicare Part A, hospital insurance. B, medical insurance. C, Medicare Advantage plans. And Part D, prescription coverage. Now, Medicare Part A and Part B, they cover a lot more than just the hospital insurance and the medical insurance. But I always tell people, just remember hospital for A, medical for B. It makes it much easier. Okay, the Part A hospital insurance. That'll include, of course, your hospital stays, room, meals, nursing, doctor care, not covered under Part B. That can get a little confusing because you're going to see that when we go over what's under Part B, some of it's going to be overlapping with Part A. Okay, it'll cover hospice for terminally ill people with less than 6 months to live. It'll cover hospice in the home or a facility. And it'll also cover social services and respite for caregivers. It'll cover the first 3 pints of blood. It'll cover skilled nursing up to 100 days after a 3-day hospital stay. It'll cover home health care, part-time or intermittent only, and it's the first 100 visits. It'll also cover durable medical equipment. Okay, Medicare Part B, that's your medical insurance. That'll cover your outpatient medical care, your doctor's care, not covered by Part A. And again, like I said, there is overlapping with Part A and Part B. Medicare Part B will cover your mental health counseling, second surgical opinions, preventative care. It'll cover after the first 3 pints of blood. If you remember, Medicare Part A said it will cover up to the first 3 pints of blood. Now, Medicare Part B will cover after the first 3 pints. And it'll also cover drugs administered in a doctor's office. It'll cover your labs, x-rays, and tests if they're medically necessary. And it'll also cover personal diabetic testing supplies. Your Medicare Part D, which is your prescription program, that'll cover your diabetic medications, but it doesn't cover your supplies. The diabetic supplies are covered under Medicare Part B. A lot of people get that confused. Again, Medicare Part B will cover home health care again if it's ordered by the doctor, and up to 100 days in a benefit period, and not long-term care or custodial care. It has to be temporary. It'll cover ambulance, but it has to be an emergency transport when there's no other way to get somebody to where they need to go. And then they would have to go to the nearest ER. They would not have their choice of hospitals. And of course, it does not cover cab rides. Occupational and physical therapy. It will cover for treatment that will improve your health and to return to everyday activities. And of course, there's always limits and exceptions to everything. And again, durable medical equipment. They overlap with Medicare Part A and Part B, but they both cover durable medical equipment. Medicare Part C, that's your Medicare Advantage plan. That's your maintenance, your health maintenance organization, that's your HMO, preferred provider organization, that's your PPOs, and your special needs plans. Now, the Medicare Advantage plans, the Part C, they are run by private insurance companies, but they are overseen by the Center for Medicare and Medicaid Services. So every summer, these Medicare Advantage plans have to submit their plans to Medicare for approval. If Medicare approves them, they can sell them for the following year coverage. If Medicare does not approve them, they cannot sell them. And of course, Medicare Part A and Medicare Part B, they are under the Center for Medicare and Medicaid Services. The Medicare Part D, that's your prescription drug coverage. And that's, again, offered through private insurance companies. Now, you can get what we call a standalone prescription plan, and that's usually for people who get a Medigap policy, which I'll talk about in a few minutes, because Medigap policies do not provide prescription coverage. The Medicare Advantage plans, the majority of them include the prescription coverage, sorry. And the Medicare Part D, of course, will cover outpatient prescription medications, generic and brand, and vaccinations not covered by Medicare Part B. Okay, this is what original Medicare doesn't cover. Drugs unrelated to illness, private duty nursing, long-term care. There is a long-term care insurance that people can purchase. Medical care outside the United States, homemaker services, Meals on Wheels, IV delivered antibiotics, but that's just for hydration. Non-emergency transportation service, alternative medicines, and routine dental and vision. Now, a lot more of the Medicare Advantage plans are carrying some dental and vision coverage now. It still isn't what I would consider 100%, but it's better than nothing, because at one time they weren't covering anything.
Denise,
Yes.
when you had original Medicare in your previous slide, what does that mean?
Original Medicare, that's that red, white, blue card that I showed you back a couple of slides ago. That card will cover 80% of all your health care. Now, people need to get a supplemental plan to go with the Medicare card because the Medicare card only covers up to 80%. So they need something that's going to cover that other 20%. That's where either the Medigap comes in or the Medicare Advantage plan.
Okay.
Okay. Okay. This says here 2020 Medicare costs. Unfortunately, this is a state program that was sent to us last year, and we were told this is the program, the presentation that we have to use. They have not done anything to update it for this year for us, but I do have the updated cost for this year. So let's see. Medicare Part A, the monthly premium is, here we go, $471 a month. Now that's for people who have less than 30 quarter hours of work. What it equals out to is if you've worked 10 years of your adult life, you get your Medicare Part A premium paid for. If not, and you want to get Medicare Part A, you would have to pay this year $471 a month. And of course, most people are not going to pay that. The Part A deductible for this year is $1,484. So as you can see, of course, everything goes up from year to year. Okay, inpatient hospital. Of course, days 1 through 60 are free. Days 161 through 90 would be $371 a day. Now, this is all if you just have original Medicare. If you have a supplemental plan, most of this is paid for. Days 91 to 150 would be $742 a day. Now, under Medicare Part A for skilled nursing, it would be, here we go. Of course, days 1 through 20 are free. Days 21 to 100 are $185.50 a day. Now, Medicare Part B premium, as of this year, is $148.50 a month. And that usually automatically comes out of your Social Security check. If an individual has an income above $88,000, then the amount goes up. Okay, and the deductible for this year for Medicare Part B is $203. Now, most Medigap policies do not cover the yearly deductible for Medicare Part B. Medicare Advantage plans, they do absorb that. So most people do not have to pay that up front. Okay, this is the different ways that we can get, you can get, have a Medicare. you can get original Medicare and then just get a standalone prescription plan. The problem with that is you're going to be paying the 20% that Medicare doesn't cover every time you go to a doctor or a specialist. That's why it's important to get a supplemental insurance plan to cover that 20%. Here's where the original Medicare, the Medigap plan, that's a plan that will cover the 20% that Medicare doesn't cover. And then because they do not provide prescription coverage, you have to get a standalone prescription plan. The Medicare Advantage plans, those are the HMOs, the PPOs we just talked about. You can get those with or without drug coverage. Most of them have drug coverage. And then, of course, there's original Medicare with other coverage, such as TRICARE, and that's if you're a federal employee. You get TRICARE for life. It's a very good insurance. The VA, of course, veterans, a retiree or employer insurance. Then you don't need any supplemental insurance because these would be your supplemental insurance. Okay, Medigap policies. It's a policy that pays part or all of the remaining costs that original Medicare doesn't cover. I do not know of any Medigap policies that only cover part. All the Medigap policies I am aware of, they will pay the entire 20% that Medicare doesn't pay. That's why they're such good policies. You cannot have a Medicare Advantage plan with a Medigap. You can only have original Medicare. And of course, as I said, it does not include prescription coverage. Medigap policies are very good. Unfortunately, they're more expensive. And a lot of seniors who are on fixed incomes cannot afford a Medigap policy. That's why they go with the Medicare Advantage. Because even though with the Medicare Advantage, there's co-pays and co-insurance, they're more manageable for them.
Denise, we have a question.
Mm-hmm.
Someone asked, would Medicaid be a supplemental insurance? From your previous slide.
It can be. It depends on, and again, I'm not real familiar with Medicaid because that's through the assistance office, but there's different levels of Medicaid. So it depends on what level of Medicaid you're approved for, whether or not you would have supplemental insurance. My understanding is, if I have this correct, I believe you have to have full Medicaid in order to get the health coverage. If you only have partial Medicaid, you may get food stamps and some other things, but you don't get the health coverage.
Okay. Thank you.
Okay, there are different Medigap policies, and of course, they're sold by private insurance companies also. And all these letters are the different Medigap policies. They are standardized policies, meaning that it doesn't matter which insurance company sells you a policy. Whatever policy you buy, regardless of what insurance company you buy it from, they have to offer you the same coverage. The only difference is different insurance companies charge different prices. That's why I always tell people when it comes to Medigap policies, shop around. You don't have to get a Medigap policy with a company that's local or in your area. Nowadays, especially with communication being the way it is, if you can find a Medigap policy from a company in Texas that's like $40 a month cheaper, get it, because they're going to offer the exact same coverage. You're just going to save yourself money. Now, they say Medigap policies are sold in 3 ways: issue age, attained age, and community rated. I have found that issue age and community rated have really fell by the wayside. Most of the policies now, if not all of them, are the attained age, which means that the cost of the policy goes up from year to year. The only company I know of that sells community rated plans is AARP. The issue age was where if you would get a Medigap policy at 65, the premium would not go up. It would only go up like every 5 years, where with the attained age, they can raise the premium every year. Community rated depends on how many people are in that policy. That bases on how much the monthly premiums are. Okay, original Medicare, of course, doesn't include prescription coverage. And you can see any doctor that accepts original Medicare. I do not know of any doctors in the entire Lehigh County that does not accept Medicare. And of course, there's no referrals needed. And it doesn't include hearing, vision, or dental coverage under original Medicare. There's no limit on out-of-pocket costs. And of course, as I said before, you can do the Medigap plan to help cover the costs. The Medicare Advantage, they usually include their prescription coverage. They are, though, in a network of doctors and service areas. The HMO plans, you must stay in the network or they will not pay. The PPO plans, they have a network of doctors, but you do have the option of going out of network for a second opinion. You just pay a higher copay. And the HMOs is when you need the referral for a specialist, not the PPOs. And as I said, now they are adding some additional coverage with hearing, vision, and dental. And there is a limit on out-of-pocket costs. And you do not purchase a Medigap plan because that's a different type of health insurance plan. And it says here, you will be responsible for the monthly Medicare Part B premium, whether you select original Medicare or a Medicare Advantage plan. Now, there is a special program that can help pay for that Medicare Part B premium. And I'll talk about that in a few minutes. Okay. Medicare enrollment, you are only automatically enrolled in Medicare if you get your Social Security early. Like if you decide at 62 you want to go on Social Security, well then Social Security has you on record. So as you're getting ready to turn 65, they'll automatically roll you in Medicare and send you a Medicare card. But if you're waiting to take your Social Security until your retirement age, you need to contact Social Security in order to sign up for Medicare. And we always tell people to do that at least 3 months prior to the month of their 65th birthday. Okay, the initial enrollment period, that's the first time you're allowed to sign up for Medicare. And again, there's a 7-month window for that time frame for the initial enrollment period. You can sign up for Medicare 3 months prior to your 65th birthday, the month of your 65th birthday, or 3 months after. After that 7-month window period, there is a penalty for not enrolling into Medicare Part B and Part D. Okay, if you sign up for Medicare 3 months prior to your 65th birthday month, your coverage will begin the first day that you turn 65. It doesn't matter if your birthday is the 30th of that month, it'll still begin on the 1st. If you sign up during the month of your 65th birthday, you'll begin your Medicare the first day of the month after you turn 65. If you enroll the month after your 65th birthday, your Medicare doesn't begin for 3 months after your 65th birthday. And again, if you wait till 2 months after your 65th birthday, it's 5 months. If you wait for 3 months, it's 6 months. That's why we encourage people to enroll 3 months prior to the month of their 65th birthday. That way they are guaranteed to start their Medicare on the first day of the month of their 65th birthday. Okay, there is a general enrollment period, and that is from January 1st through March 31st. If you enroll during the general enrollment period into Medicare, your coverage will not begin until July 1st. Here's the late enrollment penalties. If you miss your initial enrollment period and you do not sign up within 8 months of losing certain types of coverage, or within 63 days of losing credible drug coverage, there will be a penalty. The penalty for not signing up for Medicare Part B is 10%. And that means that as of this year, your Medicare Part B monthly premium is $148.50. 10% would be added on to that, and that penalty never goes away. So even if they raise the cost of the Medicare Part B premium, that 10% just keeps getting added on. When it comes to the Medicare drug coverage, if you don't sign up during the allotted time, then you're penalized 1% for every month you do not sign up. And that is based on what the monthly premium is for your plan. Okay, still working. Okay. Of course, if you're still working, as I said, you don't want Medicare Part B. So you delay enrolling into Medicare Part B. You can delay enrolling into Medicare Part A, but it really doesn't make sense because you're not paying for it anyway. And if you take the Medicare Part A, Social Security will have you in the system, so it'll make it that much easier when you do apply for Medicare Part B. And you get a special enrollment period if you're still working and you delay Medicare Part B. And of course, there's no penalty for that delayed enrollment because you have what Medicare considers credible coverage by having coverage through your employer. And the same thing with Medicare Part D. If you have prescription coverage through your employer, you can delay enrolling into Medicare Part D without a penalty because you'll have what we call credible coverage. And then, of course, you'll have that special enrollment period when you are ready to retire and enroll. Okay, insurance, if you're age 65 plus, and there's fewer than 20 employees, Medicare would be the primary and employer insurance would be the secondary. If there's 20 or more employees, employer insurance would be the primary and Medicare would be the secondary. Now, for people who are disabled with insurance, fewer than 100 employees, Medicare would be primary, employer would be secondary. 100 or more, employer would be first, Medicare would be secondary. We already talked about all this. Talked about that. Okay, when can I switch plans? Now, there's a Medicare annual open enrollment period, and that is every year from October 15th through December 7th. And then your new coverage would begin on January 1st. That's when we encourage everybody to get a cost comparison for their Medicare Advantage plan, or if they have a standalone prescription plan, because those plans change from year to year. Medigap is different. You can change your Medigap policy or get a Medigap policy anytime during the year, as long as the insurance company is willing to accept you. But when it comes to the Medicare Advantage and the prescription drug coverage, most people only have that one opportunity to do cost comparisons and make changes, and that's during the annual open enrollment period. There are some special enrollment periods for Medicare Advantage and prescription drug coverage, but they're very limited. Medicare Advantage open enrollment period. This gets a little confusing. But between January 1st and March 31st, if you want to switch or disenroll from your Medicare Advantage plan, you can. Okay, this is if you go onto the Medicare.gov website. It's www.medicare.gov. You can set up what we call a My Medicare account. Now, you can also go onto that website without creating an account. And that's what most people do. They don't want to be bothered with, setting up an account for the few times that they go onto the site. Now, here are some of the cost-saving programs I was talking about earlier. Here's the Medicare Savings Program. Now, I have some figures here too. Let me find them for you. Okay. Okay, Medicare Savings Program. In order to be eligible for that and to have your Medicare Part B premium paid for, you have to, a single person would have to earn less than 1,400, I believe it's $460 a month. And then there are income levels also. And the extra help program, that would be to have your Medicare Part D, that's your prescription coverage premium paid for, and it would lower the cost of your medications. Now, for the extra help program, there's partial help and full help. So it depends on what your income level is, but again, you have to have a certain amount of certain level of income in order to be eligible for that program. Now, the PACE and PACENET program, you must be 65 in order to be eligible for the PACE program. Now, if you're eligible for the extra help program and you're also on PACE or PACENET, what'll happen is you'll use the extra help program first because that is less expensive. But if, for an example, your doctor puts you on a medication that's not covered under your plan, your prescription plan, then you can submit it through PACE or PACENET, and then they'll pay for it. So you're still going to get it at a lower cost. The PACE plan, you need to, if you're single, you need to earn less than $14,500. If you're married, you need to earn less than $17,700. You would pay $6 for generic and $9 for brand medications. For PACENET, a single person has to earn less than $23,500, and a married couple has to earn less than $31,500. And then you would pay $8 for a generic medication and $15 for brand. Now, the extra help is cheaper in prices for the medications than PACE, but PACE and PACENET are still relatively inexpensive. Okay, I always tell people, especially as it gets closer to the open enrollment, which would be probably at the beginning of October, because plans aren't allowed to send out any information to people until October 1st. But come October, you start getting things in the mail from different insurance companies. Read all your mail, because it could be from the plan you already have telling you about changes for the following year. And a lot of people, what happens is they don't read the mail because they get inundated with all this mail from insurance companies. They just start throwing it out. And what happens is come January, I get frantic phone calls from people saying, my health coverage went up $20 a month. Well, it's too late then. There's nothing I can do to help them because they had the opportunity to change and they didn't. That's why it's really important to look through that mail. Of course, keep your Medicare card safe. Now, if you have a Medicare Advantage plan, you do not use your Medicare card because Medicare pays that plan so much money a month towards your care. But I always tell people, keep your card safe. Don't throw it away or anything, because there may come a time when you are going to need to use it. And of course, to replace a lost card, you contact Social Security. If you suspect fraud, report it. There is a Medicare Patrol that you can contact that they investigate fraud. And of course, here's the different places that you can get help with your Medicare and your health coverage. The Apprise Telecenter, you might as well just call my office because they're just going to send you here anyway. And that number is 610-782-3200. That's our information and referral unit. And then they'll just take the information, either that or they'll transfer you up to me. You can also call 1-800-Medicare, but again, a lot of times they'll just give you my number and tell you to call me. So it's easier to just call me, or call, I should say, my office. Okay, here's the number for Social Security, the 1-800 number, and then their email address. Here, the Senior Medicare Patrol, that's what I was just telling you about, that they investigate Medicare fraud. That's their number. And the Pennsylvania Health Law Project, they help people who are having trouble with their health insurance, and it becomes a legal issue because as counselors, Apprise counselors, we don't have any legal training. You know, we're not attorneys or anything like that. These people at the Pennsylvania Health Law Project, they are attorneys. So if it ends up that the problems that you're having with your health insurance plan end up being legal problems, these are the people that you contact because they can help you. Okay, of course, we're always looking for Apprise volunteers. The problem is being an Apprise volunteer, there's a lot of training involved. And also, our hours are usually regular business hours. And a lot of people can't do regular business hours because they're already working. They, talk to me and they say, well, can I do it in the evening or on the weekends? There's nobody to oversee them during that period of time. But if you know of anybody who is interested, have them contact my office and I'll be glad to speak with them.
Wonderful. Thank you so much for going through that information and for presenting with us this morning.